Welcome, everyone, to the Four Eyes podcast, brought to you by YoungOD Connect. We give you a clear view into the new grad optometry world across Canada and the US. And we are your hosts. I'm Dr. Amrit Bilku.
And I'm Dr. Deepan Kaur.
And now, Deepan, you can go wild.
Yes. So this week, we're going to be talking about another case. I know the last couple of weeks we've been doing cases because you guys seem to like them. So we're going to continue with them. So this particular case, I didn't see it myself, but a colleague of mine saw it and she told me everything about this case. And I just thought it was really interesting.
Mm-hmm.
And I feel like there's a bit of tidbits of knowledge that you guys can get from it because I kind of learned a lot and I'm already 5 years into practice. And I was like, oh my gosh.
Yeah.
So, this one colleague I have, she usually gets all this weird stuff and then she tells me all these stories and I'm like,
she's the weird OD.
Well, she gets all the crazy patients, I think.
Yeah.
And then I'm like sitting there with all my easy patients and I'm like, damn, I didn't get any of that this week. But she tells me, she comes and sits in my chair and she's like, oh my God, Deepan, let me tell you what I saw this week. And we're literally 5 feet away from each other. And I'm like, how are you seeing all these people? Okay. So yes, like I said, I don't know every detail of the case, but she told me mostly of everything. So Amrit, if you have any questions, I'll try my best to answer them.
Oh, I definitely will because honestly,
hopefully I'll know but what she did or what we would have done. But
I'll be like, oh, I already solved the mystery. It's this, it's X, it's Y, Z.
Yeah.
But no, I'm excited. And for all the listeners, just so that you guys know, I have no idea what this case is. Deepan hasn't shared it with me, but I remember Deepan when you brought it up last month, we were planning it out. You did mention it was like a kind of a retina case.
Yes.
And I was really excited for that because the retina is, I look at it, I make sure it's not bleeding and it's not waving, in the vitreous. But the retina is not my forte. So for me, actually, I think it'll be really refreshing and it's nice to, get the gears, get the cobwebs, dust it off and get the gears turning about posterior seg.
And I think, I feel like new grads that are listening to this or people or students who are just about to graduate, you might find it weird that when Amrit was like, well, the retina is not my forte, you'll notice that over practice that certain skills become your forte and other skills you don't pay as much attention to. So that's very normal. Even though everything is being checked, there's certain specialties that start to develop.
Oh my God. Can I tangent off and add on to that actually? Because anyone who's listening, I think that's really important to know because that hit me really hard in my residency. I had a pediatric patient who had pediatric glaucoma. My patient I was having all these other things and I was like, okay, I know nothing right now about pediatric glaucoma. It's not really in my head right now because I'm just surrounded by BV stuff.
Yeah.
And I felt really bad one day. I told my residency mentor and she was like, listen, no, that's not my thing at all. You know what? We have amazing glaucoma optometrists right down the hallway. And I am more than happy to say, no, thank you. I'm not going to talk to anyone about their glaucoma. Let's, walk you down over to somebody else. And I think that really, should still apply for practicing in real life because that is how we can start co-managing patients with their ODs. You don't always have to feel stressed that you need to know everything, especially as a new grad. When you start to find your forte, don't feel embarrassed that you like one part of the eye more than the other. And
this is how I feel about children. I'm like, a child.
We're really bad ODs to learn from.
No, we're just being honest. No. Okay, if anyone else tells you otherwise, I just don't think it's the truth. I mean, yes, there are certain ODs there that try to do it all. Okay, fine.
But that's tough.
We're just being honest. Most of our colleagues and friends that are optometrists, they have a specialty that they prefer. And some of them like retinal disease and ocular disease. Some of them like vision therapy. Some of them like specialty contacts. It's just normal.
The cornea.
The
Mm-hmm.
cornea, yes.
Mm-hmm.
But anyway, so I'm gonna start off with this
Yeah.
case. So my colleague, was in work and she saw a brand new 82-year-old Caucasian male patient. He was in for a full eye exam. His last eye exam was about a year ago at a
Okay.
completely different clinic. And, basic information, he wore progressives full time, no problem. He had no complaints about his vision in general. And he said his vision is very comfortable with his progressives on at distance and up close.
Mm-hmm.
Even and he got his glasses a year ago and he was
So
like,
no
nope,
concerns.
there was no concerns, nothing. And he was just only on high blood pressure medications and cholesterol medications only. So my colleague started doing the exam. She checked the VAs, and the VAs in the right eye was 2025 and 2025 minus a letter in the left eye. Okay. Just being very detailed.
Yeah.
Pressures were really low teens in both eyes, 10 in the right eye, 12 in the left. And his anterior segment findings only showed like a grade 2 nuclear sclerosis in the right
Mm-hmm.
and left eye. So no real concerns there. She took optomaps, the pictures, and his posterior segment findings were pretty much unremarkable
Mm-hmm.
in the right eye, and his left eye was pretty much unremarkable, but it just showed this one very small pinpoint dot blot heme in between the macula and the superior arcades. Okay. And
One
maybe
heme.
just one
Mm.
heme. Okay. And then his vessels seemed maybe a little bit more tortuous um, in that left eye compared to his right eye, but she couldn't really tell. Like she was just trying to find really honestly something
Yeah, I
there.
feel like once you like think that it's something, you're just gonna keep like digging for stuff
Yeah, and then
and
because you're
fishing for
like, okay,
something.
what
Yeah,
is this? So interestingly, she actually asked for the previous eye exam chart before he even came in. So those came in for
good.
us.
Lucky
And
her.
yeah, because that's another
You
thing, folks.
that does
You
not
don't get
happen.
their previous eye exam results. So I know a lot of patients will come in and they think it's like when they go to their family doctor, they're like, oh, you can see all my past information. No, not for
No.
the eye exam, right? So I know a lot of seniors will be like, oh, like, can you see what was done at my last eye exam? I'm like, no, we don't have your previous charts. We're literally starting from scratch here.
Yeah.
So we're getting everything done.
And the best is
Um,
when they show up and then they tell you, I've been seeing a specialist for 25 years. I've been getting
mhm.
needles in I don't know which eye, and
Yes.
I had all these lasers done.
Yeah.
And yeah, now I just decided I want to come here now.
Yes.
And you're like,
And they can't
Okay.
see. So what
And they can't
happened?
see. And they're, finger counting 2 feet and their glasses are 15 years old. And then their visual field is just
So,
tons of
you
blind
know
spots. And
what?
then you don't know what
That's
the
not
hell happened.
even,
You're like, you know what? We'll just start from scratch because I have time.
yep. Yeah, right? Your story's not even an over exaggeration. That is my,
No,
at my
all the
clinic, we
time.
have a lot of senior patients. That's like most of them, especially when we get new senior patients. And I'm like, cool. Now we're going
Yeah.
to spend an hour and a half on you. And I have 15
Yeah.
more people to see.
So
Yay!
thank God she got like
Yeah, so
the
she's
details
actually
from
pretty
before.
adamant about getting the previous results compared to the other doctors that work at this
Mm-hmm.
clinic. So,
Yeah.
um, okay, so she went through the chart before like the previous exam, and she also found in that previous chart that that previous doctor also made a note of this one dot blot heme in the left eye between the macula and the superior arcades. So she was like, "Oh, okay, interesting, fine." But his vision in the right eye at that time a year ago was 2020. Vision in the left eye was 2020 minus 2. Okay.
Mm. Okay.
Uh, so, um, so she decided, okay, you know what? Since this particular heme was found at last year's eye exam, I'm still gonna bring him back for a dilation. We'll do that. So when she brought up the idea of dilation to this patient, he was, or actually, sorry, she wanted to do it the same day, but he
Mm-hmm.
was like, I don't have a driver. So I'm not
Mm-hmm.
doing that today. And she was like, okay, fine, let's bring you back whenever you can come back to do it. And then patient's personality came through and he was like, why do I have to come back? Why do I need to come back for this dilation? So he was very resistant to come back at all. So she was like, trying to explain, I know that we have your
Oh,
past chart
bless
that
her
we just want to.
soul.
But so we get this a lot at our clinic. There's a lot of like, I don't want to do this today, a lot of refusing, blah, blah, blah. So she explained to him again, like, no, I need to do this dilation. I want to check, your cataracts a little bit better. I want to check the back of the eye a bit better. I just want to further assess this little dot blot heme you have at the back of the eye. And he was like, fine, I'll do it, but still with a lot of resistance. So she
Mm-hmm.
wasn't sure if he was gonna come back or not, right?
Mm-hmm.
So last minute, she just decided to do a macular OCT on him because she was like, at least I can get some sort of explanation possibly for this dot blot heme because I don't know if he's going to come back or not. He's brand new to
Mm-hmm.
us. I have no idea. So she actually got the macular OCT done on his right and left eye. And right eye, no problems. Everything was within normal limits. The retinal layer was intact. And then left eye, there were a bunch of intracystal cysts or
Oh,
intraretinal cysts
bingo.
right near his fovea.
Mm.
So with the now the results that with the OCT, what do you think she would do now, or what would you do next? And
Where
what
was the
would you
patient
say?
at this point? Like ready to check out
Ready
and
to
leave?
leave, like putting on his jacket.
Oh my
And she's
God.
like, let me just, and he did book for the DFE, okay? Like he did book for the dilation,
Yeah, but you can never
but he was
trust it.
like, yeah, he was like, fine, if I have to do it, I'll do it, but I don't
Mm-hmm.
understand why. My vision is fine. Like I told you, that finding with the dot blot heme in my left eye was found last year. Like I don't know why I'm coming back. I got dilated last year. I'm fine.
To be honest, depending on how busy, like if, yeah, if the patient walked out at that point, then I mean, it is what it is. You have to call them, leave them a voicemail, tell them what you found, and
Yeah.
make sure that, you tell them why it's important to come back. And then you go to your room and you go clickety clackety click,
Yeah.
document
But
the whole thing. But if the
right.
patient is, yeah, like in the waiting room ready to go, I always tell the patient that like they're not leaving after a scan
Yeah.
until I give them the green light to go. So, I
Yeah.
mean, he should not be going. He should not be putting his coat on. And I would make sure like my staff would know that too. So like the
Yeah.
staff would also be like, "Sir,
Stay.
you're not going anywhere yet. The
You
doctor
have to
needs to
stay.
just check in on you."
Yeah.
So I think that's what I would have done. Like I would have went into the waiting room because that's what I
And you
do. And
still
I'm
tell
always
him
like,
exactly like what's happening and everything.
well, yeah,
Like
I
what is
always
going on.
say, oh, you know what? We found something on the scan. Come on in because I have to show you what it is. And obviously,
Yeah.
once you say we found something, most
Hmm.
people will at
Most
least be
people,
interested to be like, okay, like what is it?
yeah.
They
So
might not be
what
happy, but
that's the other part now. Like what are our differential diagnosis for this one dot
I
blot heme
mean,
that now is several intraretinal cysts? We're thinking of, like vein-based conditions or vascular disorders, possibly like diabetes.
yeah.
Like I have a list here of like ocular ischemic syndrome,
Yeah,
sickle
go over
cell
these with
retinopathy,
me. Do
and
it, do it, do
and
it.
venous occlusive disease, right? So
Hmm.
these are all like, there's something obviously going on, even though he feels like his vision's not affected. He did decrease by one Snellen line, right?
Yeah, and that was
Um,
just in a year, right?
a
Compared to,
year, right?
yeah, yeah,
Yeah,
that's
exactly.
significant. Especially with
Um,
pinhole, if there's no improvement, then we
that's
can
that was the
confirm
other thing. So
that's
that's the one part I did
definitely a
forget to
change.
mention in her case. She did try to do pinhole and it didn't
Hmm.
improve. But
Yeah.
now her thinking at that point was it's because of the cataracts. Like the cataracts are
Mm.
there. That's why he's 2025. Like that makes sense. So you're right. She did bring the patient back and he was like, what? What do you want? What is
Oh
it?
my gosh.
And she showed him the scans and what that swelling was at the back of the eye. And she was like, I'm going to refer you to a retina specialist because there's something going on here. There's something going on with that heme at the back of your eye. And he became even more irritated at this point because he was like, I have to be sent to a specialist for what? What reason? What I understand what you're saying, but my vision is fine. So he just kept on saying, it's been a
Yeah.
year. My vision hasn't changed. And this patient came in. This is like at the end of the day, okay? Like I think
Yeah.
this is one of her last patients. So she's kind of like, I'm kind of over arguing with people
Mm-hmm.
now.
Yeah, I would be
But she
too.
was like, look, like I need to send this. This was not found at your last eye exam. Nothing was found like this particular finding with the macular OCT was not found. So I'm going to send you to a retinal specialist because there's something going on and it could be possible your vision can become worse. And this was like a 10-minute conversation. And this is also normal, everybody having these conversations with seniors
Yeah.
sometimes explaining, like, yes, you'll have to go to a specialist. You're going to drive there. They're going to dilate
Yeah.
you. You're going to go through this whole thing. Um, the patient ended up seeing, thank God, the retina
Yeah.
specialist
I was like,
3
wow.
weeks later. He ended up going
Got it.
because this is a report back she got from the ophthalmologist.
Mm-hmm.
And 3 weeks later, his vision in his right eye was still 20/20. Vision in his left eye decreased to 20/40. Pinhole,
Wow.
no improvement. Okay. And this is
Wow.
with correction, right? So the ophthalmologist in the report said he performed the fluorescein angiography where they check for basically any leakage with the vessels and everything.
Mm-hmm.
And he didn't, like, the ophthalmologist didn't give us exact details of the FA procedure or like what they found,
Mm-hmm.
but the diagnosis was an impending retinal vein occlusion in his left eye. Not
Wow.
only that, the ophthalmologist put in the letter thanking my colleague for sending that referral as quick as she did because he was like, if I didn't see this as quick as I did, his vision would have been way worse.
Yeah.
Like almost,
Yeah.
probably like 20/80, 20/100, whatever.
Yeah.
So
Holy
he
crap.
yeah, so he got like injections and everything and now he's doing okay. That just what blew my mind. Like this patient was so reluctant with
Yeah.
my colleague. This one dot blot heme that was found previous eye exam. I know for me, if I saw that with just how reluctant the patient was being, I'd be like, honestly, I think I would just bring him back for the dilation. I wouldn't even think
Yeah.
about the
And
macular
like
OCT.
monitor.
No.
Yeah.
Yeah, me too. I wouldn't even, I'd be like, I'm just going to bring him back in a week or whatever when he can come back,
Mm-hmm.
and then we'll take a look at this. Honestly, that's what I would have done. And I
Yeah.
don't know what
It's
clicked in her
tough.
mind to do that OCT because that's when she saw that finding. And she's like, nope, I'm sending you to the retinal specialist right
Well,
away.
yeah, because I agree. In the moment, I would I have really done a MAC OCT? I'm not 100% sure, but
Mhm.
when you brought up that she assumed that maybe the decreased VA was from the cataracts, I
Yeah.
do pay attention to the cataracts though,
Hmm.
because again, if the patient is slowly declining in their VAs, but asymmetrically, but those
Yes.
cataracts look symmetrical,
Exactly. Yes.
I would have done a macro CT, especially
Yes.
if there is then a dot heme and you
Yes.
see that tortuosity, if there's no positive foveal reflex, if
Hmm.
the macula just looks like it's mottled or it's like it's just not smooth,
Yes.
um, on the optos, I heavily rely on optos because again, yeah,
So do
my
we.
you know,
Yeah.
my retinal skills are not that great. But yeah, I always take a look at like even the quality of the macula on the optos per eye. If the
Hmm.
quality is looking different, then I really pay attention on slit lamp. And then if those cataracts looked very mild and very symmetrical, I don't know if I really would have blamed the left eye getting worse on the cataract
Yeah.
because then
Well,
the
yeah,
right eye
because
would have
like,
gotten worse too.
yeah, and that's because we got the previous results from the
Yes,
eye exam, right? Because he was
100%.
20/25, you know, in both
Yep.
eyes. And then was 20/20 just a year ago. So when she saw that, she was like, that's kind of
Yeah.
strange.
You know what? That you're right. Without any data, if I
Hmm.
just saw a blot heme, one blot heme in
Yeah.
even in one eye, to be honest, yeah, I probably would have had that conversation with the patient more about just getting your blood work checked with the family doctor. Like just to
Yes,
be
that
like,
too.
check for diabetes, high blood pressure, cholesterol, any clotting disease, whatever. But I would not have referred to ophthalmology first. I would have been like,
Yeah.
okay, you have a little bleed in the eye. Let's check your blood vessels and go see your family doctor now. And I
Yeah,
still probably would not have made it urgent. I would have just
I know.
written the letter to be like, okay, like, yep,
Go
go
check. Yeah.
go check with your family doctor and then send
Yeah.
me the report and that's it. And
Yeah.
then follow up in like, a month for a DFE
And
with
like
imaging again.
the other thing is, so say if, again, the patient, she didn't do the macular OCT and yeah, she was like, yeah, the patient can come back for the dilation and say he was going to come back a month later or whatever. Even if his vision decreased in that left eye, he probably wouldn't even notice because he's looking with both eyes and he probably would
Yeah.
have been like, yeah,
Yeah.
everything's fine.
No,
What are you
he
talking about? And then
wouldn't have
in that
noticed.
month, or like maybe he would have came back sooner because his vision just would have obviously significantly decreased at that point.
Yeah.
He might have been like, oh, now, yeah, I can't see out of my left eye. Do you know why? What's
Yeah.
going on? And
Yeah.
then you know,
It
it's
could be
just
too
going to be
late
a
at
full
that
blown
point.
CRVO at that point, right? So
Wow.
and I know you were kind of already talking about this, but like, how do we decide when to monitor or refer our patients that have these random like retinal hemes, even if they're just this one dot blot heme, right?
Yeah.
You mentioned a couple of them already, but that's why you got to take that thorough case history, ask about their meds, ask about systemic diseases, any ocular trauma, activities during daily life.
Yeah.
All of these kind of things are super important. Um, I know with the hustle and bustle of clinic, like sometimes, yeah, you only have like 20, 30 minutes to see your patients. And then you just kind of, when these small findings come up, you're like, yeah, it should be fine. Like I know for me, I'm like, dot blot heme. Yeah.
Yeah,
But
I'd
it's
be
just
like,
so
it's fine.
close.
Come back in a month and like we'll keep an eye on it. But like you're
Yeah.
not really going home thinking about it, being like, what could
No.
it have been? You're just like, I just want to make sure I see you again so it doesn't get worse. Whatever
Yes.
this is.
But
Yeah, like that's like the end goal, but we're
yes.
not like paying attention enough in clinic to be like, okay, let's stop and investigate it like right
Yeah.
now.
But
Yeah,
I think the main
it's
thing is
true.
like now we got to think about when these retinal hemes can, like, they're in a vision threatening area. Like the
Mm-hmm.
fact that it was near the macula,
Yeah.
okay. Maybe that it's like, okay, why is this here? If it's something more peripheral, then it's like, okay, come back in a month, we'll
Yeah.
dilate it, we'll see what's going on. Yeah, if it's close to the macular region or fovea, um, yeah, bring them back sooner, consider taking a further look at that. And then, yeah, think of all your differential diagnosis,
Mm-hmm.
that those retinal vein occlusions is a big one when you see those hemes by the macular
Yeah.
region.
Well,
And
I feel
that's
like,
now something in my head if I ever
yeah.
see that.
So
Again,
I'm
it's not
curious to
just,
know for this OD because
hmm,
like right when she saw the swelling in the macula, she said, I'm going to send you to a retina
hmm.
OMD. Did she also send immediately to the family doctor though? Like or was it just like does ophthalmology handle contacting the family doctor to like make sure they get blood work or does ophthalmology get the blood work right away and like
So this
yeah.
particular retinal specialist we send to, he handles all the family doctor stuff too. So he'll
Okay,
let
got it.
because this one we send to we usually just send, from our clinic we usually just send to one because, well, one clinic in general, because they're ophthalmologists there, they're all retina specialists and they're really good. um
Yeah.
so they keep up with what the patient needs to do in terms of seeing the family doctor, coming back to
Okay.
us, and they send their notes back to us. Like what I said, that
Mm-hmm.
particular ophthalmologist sent a note back to my colleague right away and told her
Yeah.
what the diagnosis was, but also was like, thank you so much for being diligent in what you
Yeah.
did to send this. And my colleague was like, yo, I was not going to do any of this. I just didn't trust my
It was a
patient to
fluke.
come
It was a
back. It was a
fluke.
fluke.
I don't know what I'm
He
doing.
straight up, yeah, no, and that is okay. And I mean, I get it.
Yes.
Like this patient, yeah, potentially could have lost vision, but she was like, I don't know, man. The angels were watching over me with that because I literally just did it because she just did not trust the patient to come
Yeah.
back. She's like, I'm going to do this macular OCT now.
Which, yeah, good for
And
her because
yeah,
honestly, I've had conversations with other ODs, with this sort of a topic, but sometimes in patient care, you just sometimes there's just battles with patients that you just don't want to have anymore. Like it
Yes,
is,
exactly.
yeah, being a healthcare professional is a mentally exhausting
Oh,
job,
yes.
right?
Mhm.
Of course. And so when there are patients fighting against you to do what you're asking them to do, at some point, people, sometimes ODs, we throw in the towel and we're just like, okay.
Yeah.
Okay,
And,
fine. You don't want to do
this is
something today? Fine. Just come back another day, please. And then
yes, that's
document.
true. And this is
Yeah.
why there's burnout with nurses, family
Yeah.
doctors, etc., right? So we all know like healthcare when in healthcare professionals they're dealing with people all day.
All
And we've
day.
always talked about this on every episode. The vibe is not always great. The
Yeah.
people are stressful, but you're right. When you have patients day in day out that don't listen to your
Hmm.
advice and argue with you with what kind of treatment you're giving them. It's just hard to kind of, you know,
Yeah.
at that point be like, okay, I'm going to do everything I can for this patient for every single.
Hmm.
We all know that. And again, that is okay. That's normal. That's
Yeah.
part of this job. But I think it was just when she told me about this case, it was just a reminder for me that like, oh my gosh, yes, even the smallest, you
Investigate.
know, findings, especially when it's near the macula, even if like again, she got that last report, the vision did decrease a little bit, look into that and
Yeah.
try to figure out, okay, what could possibly be going on here? And
Honestly, I'm not going to lie. I think actually a huge takeaway that I just took from this case is
mhm,
I think it would really benefit all of us and our patients if there was more staff training and patient education on the importance of bringing a copy of your most recent eye exam to a new office. Like,
yeah,
there are so many times that we have these new patients, especially seniors, that have gone through thick and thin and have had diseases up the wazoo, and now they have no idea what the disease is, when they had it, what they're taking,
yep,
and now they're just starting from scratch at our clinic. And I say that to them all the time. I'm like, listen, we're just starting from zero, and like that's not fair to you, it's not fair to your eyes, and then
hmm
it's not fair to my chair time to
hmm
guess what's wrong with you. Like let's have maybe staff be better trained on
yeah,
when they're booking new exams to be like, where was your last eye exam? We might
yes,
not be able to get access to those records, but we'd really appreciate it if you can get an emailed or paper copy of your record from there to bring
yes,
here so that our doctors can make sure we make sure that your health has not changed. And then educating patients on knowing that so that the patients will feel like, oh yeah, like I want to make sure
yeah. And
nothing's changed
again,
because
a
that
lot
they
of
already assume that we
yeah,
have
a lot of
access to
patients don't
everything.
realize that we don't have access to their past
Yeah.
results. So now at our clinic, we try to do that. So we try to bring
Hmm.
their or try to get access to their old records. It just
Yeah, I
depends when
think
their
it's
last eye
smart.
exam was, because honestly, if it was from, it's 2024 now, if the last exam was 2012,
Yeah.
then
Yeah.
no, like that's a
Irrelevant.
irrelevant. But
Well,
now we're trying to
actually,
do it.
so when you just said like if their file was like 10 years old or 12 years old, it's irrelevant. I actually, you know what? I've learned my lesson. I disagree with that because
She's switching,
interestingly
she's flipping
enough,
on us
yeah,
live on the podcast.
I'm switching it up.
Yeah,
I'm doing it.
yeah.
Because no, interestingly enough, I have one patient who's in her late 50s.
Hmm
Again, brand new patient to our office, and the last eye exam she ever had was 12 years ago.
Of
And
course.
when yeah, no, and again, 2020 vision, like no cataracts, nothing. Like she's a healthy person and she's like, yeah, I've never had a problem with my eyes. Her nerves were definitely large. They were thin, maybe about like point 0.7 round. And she had blind spots, more so in one eye than the other. But her eye pressures were pretty normal. So I asked her for a copy of her old records because then I did the whole glaucoma talk. Have you ever done a clicker test before? Maybe, I don't know. When's
hmm
your last eye exam? 12 years ago. Okay, well, you know what? Let's get a copy of that exam because I just want to see, what's going on. That OD, graded her optic nerves, her CD ratios as
Point one.
point 0.2. 0.2 in both eyes.
Oh my, oh wait, oh my
Point
God.
0.2 in both eyes, no visual field defects. She was seen by that doctor annually. So I got
Yeah.
the last two reports from 12 and 13 years ago,
Oh
point
my
0.2
God.
round. And I looked at her nerves again and I said, Amrit, come on, don't get this wrong. Don't get this wrong. I'm staring at it. I'm like, it is point 0.7. And then I referred to ophthalmology. They assessed her and yeah, normal tension glaucoma. So don't, yeah, you know what? Even if
Oh,
that report is 10 years old or 20, just take it. Just take it and like use it. You have to compare.
point two.
Great point
There's a point
two.
two.
I was like, no way. No way, point two. But yeah, because it was
You know what?
consistent
Sometimes
every
I don't.
time.
Yeah, you know what? I've seen that a couple times, and you look at past charts from previous doctors, and you're like point three, and you're like,
Yeah.
these are point eight nerves. Am I an idiot?
True.
And you're just like, all right, let me just recheck
You
this
just
because
got
you're
the
like, I'm
baton
not.
passed to you. Congratulations. You have to have that conversation with them now.
I know, and you're just like,
Not fun.
wait, what?
It's not
But
fun.
yeah, no, maybe you're right. Like, it doesn't. You know what? More information is good information,
Mm-hmm.
right? So yes, you do
True.
have to analyze it, but it's just again, just taking better care of your patient. And you're right. Like, the important things from this case again is investigate if you're not 100% sure, especially anything near the macula, and getting past results. Because yeah, if she didn't have that past chart,
Mm-hmm.
I don't know if she would.
Yeah. Done the same
Well, I
thing.
think, well, no, she would because she didn't trust the patient. But for me,
True.
I wouldn't, if I didn't have those results, or even if I did, I think I'd still bring him back for that
Yeah.
dilation like a week or a month later or whatever, because I was like,
Yeah.
yeah, his vision seems to be fine. Like I don't know. So
And the
just a huge
last,
learning thing for me. Like I had to humble myself and I was like, okay,
yeah,
yeah,
I
I
would
can
have to as
definitely
well.
be a better doctor tomorrow. And that's why it's good to share cases too, just like what we're doing with this, our series of case reflections and everything, because we want to share our experiences and, make
Yeah.
you guys better doctors and us better doctors. So
100%. Yeah.
yeah,
Yeah. Thanks, Yvonne, for sharing that. That
yeah.
honestly, that was like a wake up call for me too. I definitely need to pay attention to the retina a bit more. And yeah, we will try our best to bring up more.
Mm-hmm.
I think we mentioned it in the past. It's so difficult to pinpoint cases now, practicing 5 years out because yeah, it's practicing in clinic is almost like a rinse and repeat situation. And
Mm-hmm.
even if we see unique cases, we're just so busy in our heads that we're just like, okay, that was cool. Now
Move
moving
on.
on, moving
Yeah.
on, go to the next one.
Go to
We
the
don't
next one.
dwell on them as much anymore
Yeah.
because like our fascination, I guess, is
Become
fading.
desensitized to what it used
Yeah,
to be.
literally it's fading. And but yeah, I think
No,
it's
but it's
fun
still
because it
fun.
brings
Like,
it back. It brings it
yeah,
back for
like
us, like how we used to
I
feel even back in the day.
Yeah. Like, well, no, when my colleague told me this case, I got all giddy inside and I was like, oh my God, tell
Yeah.
me more. She's like, oh my God, I'm going to tell you more about this part and this part. So, no, she always brings excitement to my days. And I'm hoping one day I can give her a case back like that.
Yeah.
But yeah, hopefully you guys enjoyed it. And then, all right, thanks for listening to Four Eyes, the podcast series brought to you by YoungOD Connect. Be sure to subscribe and follow us on Instagram or YouTube at Four Eyes Off Tom for more content. We'll see you guys next time.
Bye.
Bye.